The one big novelty to start with is that we've ended up with more money. Doesn't always happen, and is a very nice start and perhaps a nice confirmation about recognition that Interreg receives and is receiving from the wider multi-annual financial framework process. Then perhaps to pick out a couple of key elements from the delivery approach to Interreg, the main new novelty is the idea of an Interreg Plan, which is going to contain all of the current Interreg programs inside a single document and as part of a single adoption procedure inside the Commission. And then from a delivery point of view, two elements perhaps to emphasise are an increased focus on the possibilities for supporting reform actions under cooperation, and also encouraging a much more detailed approach to performance-based approach, focusing on the results coming from Interreg programs and projects rather than focusing on how each individual Eurocent is spent. It's important to emphasise that the underlying approach to Interreg remains very constant with what we know. And that means how programs operate, how partnerships operate, how projects operate. The intention is that those all continue as we've operated before. We have separate managing authorities, we have separate program structures, we have separate secretariats, we have separate calls for projects. So all of those continue to function in the same way, ensuring continuity with how Interreg works now. The integration of different funding sources from different parts of the EU budget has worked extremely well in this current period, and we would very much expect that to continue in the future. The word reform in connection with Interreg might seem new, but it's important that people reflect on the fact that some of what we do already under Interreg could be described as reforms. And to give you just one example, we often see very positive, interesting projects on healthcare across borders, where we have hospitals and doctors combining from either side of the border to offer services to each side of the border. And we tend to call that cross-border healthcare cooperation or cross-border health offer. But are we not actually reforming cross-border health provision? And we're reforming how that service is delivered. So that can count as a reform. And it's just about changing our mindset perhaps and describing some of what we already do in different ways. We expect to see the same type of cross-border and transnational programs that we have now, with the involvement of all the different non-member states so active at the moment. And we want to see that perhaps for two particular reasons that I want to emphasise. Firstly, because it delivers successful cooperation, and we see that in the results of the programs and the projects now. Secondly, particularly in the context of enlargement, we see Interreg as a real forerunner for cohesion policy. It's the only possibility candidate countries have to implement shared management before enlargement. And that means that the institutions of these non-member states, of the candidate countries, can take part in the preparation, negotiation and implementation of these programs on an equal basis with the member states, and we want to really emphasise that in the next period.